This video is a summary of the RESTORE trial led by Peter Kent and was titled Cognitive Functional Therapy with or Without Movement Sensor Biofeedback versus Usual Care for Chronic Disabling Low Back Pain. Cognitive functional therapy is a patient-centered approach that facilitates self-management by addressing individualized cognitions, emotions, and behaviors. A key distinguishing feature compared to other psychologically informed approaches is that CFT also targets provocative movement patterns. Prior to the RESTORE trial, there was no large trial comparing the effectiveness of CFT to usual care. This study aimed to compare the effectiveness of CFT with or without movement sensor biofeedback against usual care for patients with chronic disabling low back pain. The study was a 3-arm parallel group phase 3 randomised control trial with concealed allocation. The trial was conducted across 20 primary care physiotherapy practices in Sydney and Perth, Australia. The inclusion criteria was people aged 18 and older with chronic low back pain lasting more than 3 months, those who had sought care from a primary care clinician for their back pain at least 6 weeks previously, those who had an average back pain intensity of 4 or more on a 0 to 10 numerical pain rating scale, and those who had at least moderate pain-related interference with normal work or daily activities measured by item 8 of the 36-item short-form health survey. Main exclusion criteria included serious spinal pathology, any medical condition that prevented being physically active, being pregnant or having given birth within the previous 3 months, inadequate English literacy for the study's questionnaires and instructions, a skin allergy to hypoallergenic tape adhesives, surgery scheduled within 3 months, or an unwillingness to travel to trial sites. 1-to-1-to-1 randomization of 492 participants allocated 165 to the usual care group, 164 to the cognitive functional therapy only group, and 163 to the cognitive functional therapy plus sensory biofeedback group. 18 physiotherapists across Sydney and Perth were trained in cognitive functional therapy and needed to reach competency before commencing with the trial. Usual care group participants could choose their own treatment, which was not determined or funded by the trial. Both cognitive functional therapy groups received up to 7 consultations over 12 weeks, with a booster session at 26 weeks. Initial consultations were scheduled for 60 minutes with 30 to 40-minute follow-up consultations. The primary outcome was pain-related physical activity limitation at 13 weeks. This outcome was assessed using the Roland-Morris Disability Questionnaire. Key secondary outcomes included pain intensity, patient-specific functional limitation, pain catastrophizing, pain self-efficacy, and fear of movement. 418 participants had primary outcome data at 13 weeks, meaning there was a 15% loss to follow-up. Both the CFT-only group and the CFT plus biofeedback group reported a mean reduction in Roland-Morris Disability Questionnaire scores of 4.6 points at 13 weeks, relative to the usual care group. This improvement was sustained through to the final follow-up time point at 52 weeks. The large and sustained effects for both CFT groups compared to usual care were similarly evident in all clinical secondary outcomes, including pain intensity, patient-specific functional limitation, pain catastrophizing, pain self-efficacy, and fear of movement. It is also noteworthy to mention both CFT groups were more cost-effective than usual care for the primary economic outcome of quality adjusted life years, which was largely driven by improvements in productivity. In conclusion, this study demonstrates that cognitive functional therapy with or without sensory biofeedback has a large clinical effect on improving chronic disabling low back pain compared to usual care. These results build upon previous studies demonstrating that cognitive functional therapy from a trained physiotherapist can have sustained clinical effects, which was not seen in previous studies. The evidence surrounding cognitive functional therapy reinforces how improved self-efficacy and self-management strategies are important for reducing chronic disabling low back pain.